The following is a paid program and does not necessarily reflect the views or ideas of the staff or management of KWSH or the 110 Broadcast Group.
Good morning and welcome to the Seminole Nation radio program. I'm your host, Edwin Marshall, joined in here by Jeremy FULTZ this week. Good morning, Jeremy.
Good morning, Edwin.
Hey, we got a couple of special guests with us today, and we're going to be talking about health and disease prevention, and what a appropriate topic for this time of year, or for this certain time in the year. Jeremy, you want to introduce our guest there?
Sure. We've got a lot of information coming at you guys today, and with us right now we have Captain Dana HAYWORTH, a commissioned officer who is an infection control nurse, which I've been trying to say preventionalist, I think. Preventionist all afternoon or all morning. Welcome.
Well, he's been trying to say preventionist, but since we're not perfectionists, we can't ever remember. It's good to have you here.
Infection control nurse. Thank you.
It's good to have you here.
Thank you.
We'll be talking to you just in a little bit. We got a lot of things to talk about today, and in regard to the current health situation, the pandemic, officially termed a pandemic, coronavirus. And, this is going to affect Indian country just like it is everybody else. So we thought that this would be a most appropriate topic, and not just people that are working for the tribe or the clinics, but even at home. There's going to be a lot of things that we're going to be talking about. So, but before we do, it's good to have you. We've got some announcements just real quickly. I'll try to get through the announcements that we do have. We got church meetings. Some churches may be postponing or canceling their services for this week. This is just a list that we have, and that would be, would it be March the 22nd, this coming weekend? We have Arbica Indian Baptist Church, Big Arbor Indian Baptist Church, Hickey Ground No. 1 Indian Baptist Church, High Springs Indian Baptist Church in Okemah, High Springs Indian Baptist Church in Kanawha, Hilltop Presbyterian Church in Wewoka, Little Casita, it's up near Sapulpa Indian Baptist Church, Middle Creek No. 1 Indian Baptist Church, New Arbor Indian Baptist Church, Rock Springs Indian Baptist Church, Anadarko, and Ryle Community Church near Henrietta, Seminole Baptist, it's out here by Kanawha, Salt Creek Baptist near Wetumpka, both Snake Creeks No. 1 and No. 2 in Sassaqua and Bixby, Trenton Indian Baptist Church near Hanna, Vian Creek near Vian, and Wegawa Indian Baptist Church, and that's on the west side of Tulsa, going out toward the Keystone Dam. Those churches are scheduled to meet this weekend. If you're a member there, you might check with your pastors or your church leaders to make sure that the meetings are still on. Some churches may be postponing, and others may be just going on ahead with it. So that's up to the church. No other real big announcements. OAP, by the way, is I believe it's carry-out only. Let's see.
Even Friday's breakfast is carry-out only.
Yeah. There's a lot of cancellations, and I'm not sure, Jeremy, you might, when I go over these, the Spring Fling Bazaar that was scheduled for Friday has been canceled.
Also on that, if vendors have paid, they can come collect their money or hold it until the next one. Okay.
And then, of course, tomorrow, the CHR program blood drive that was scheduled has been postponed as well.
And then to kind of piggyback on that, the Jafigny Wellness Center gym is closed effective immediately until further notice. If you need diabetic supplies or services, please call in advance before showing up. 405-234 5274 and refer to the Facebook page for any updates.
The second annual Easter egg hunt, the tribal Easter egg hunt that was scheduled for Saturday, April 4th at Miccosukee Mission has also been canceled. All of the various wellness programs, I think, have all been canceled. The Native Faces 10-week wellness program at the Wowoka Clinic and the Seminole Native American Club Indoor Stomp Dance that was scheduled for March the 28th has been canceled. All right, the Muskogee History Symposium scheduled for March 20th and 21st has been canceled. Intertribal hymn singing scheduled for April 6th at the Sam Noble Museum in Norman. Canceled.
That includes the entire language fair as well.
Yes. Seminole Nation Diabetes Program, Water Aerobics Program has been canceled. Chair Aerobics has been canceled. And that was...
Dennis seemed to be pretty bummed out about that.
I know. He was just fixing to enroll. Reading literacy classes at the Seminole Nation Higher Ed Department have been canceled.
No, those are... So, with higher ed, all educational services are still available, including GED and reading classes.
Oh.
The only thing that higher ed has canceled right now is the clothing closet, and that's closed. And right now, I think they're having some issues with their phone and internet. And so if there's any issues, you can call 405 or questions, 405-257-7200. Or you can try the higher ed phone number at 405-716-6040. And if you're ill, they said do not come to the office, call first.
Yes, and that's just common sense, folks, wherever you go. If you're ill, just stay away, make a phone call, have somebody to go for you, get your information through them. But let's all look out for one another. I assume that they're recruiting for part-time workers with the census, and the census, I'm supposed, has to go on. So if you're interested in that, you can call them at 855-JOB-2020. They're looking for census takers. Or you can go online to 2020 as 2020census.gov/jobs. Seminole Public Schools first annual Stomp Dance scheduled for Saturday, March 28th, canceled. That's this coming weekend. Free cooking demonstration done by the Seminole Nation Food and Nutrition Services. Canceled, I assume, Jeremy. That was at the Sasakwa Community Center. That would have been today. And those are the things that I have. You got some other things that have been canceled?
Well, we've got just some overall announcements here. We might wait to go ahead and do those unless we want to go ahead and get them on now.
Okay.
But since we have our guest, Captain Dana HAYWORTH, I think it's important to kind of go over some general personal hygiene information.
The chief of the Seminole Nation is here with us. Chief, would you come on into the studio, please? Greg Chilcoat.
Good morning.
Good morning, sir.
Yep, that's right. I forget about that every time.
That says a lot about character. The guy likes to shake hands, and it's easy to overlook that.
Yeah.
It is.
He and I shook hands after our meeting yesterday,
Yes.
and we both caught it. But it's good to have you here, Chief.
Yes.
The Chief doesn't get out very often. He's a very busy man, but when he does get out to the radio station, you can bet there's a very important topic. Chief, kind of put us up to speed with where the administration is right now with what's going on with the coronavirus and all of the various activities that are going on for prevention. And why don't you just go ahead and blend into a conversation with our guest today?
Yes, Captain HAYWORTH, good morning. It's good to see you again.
Good morning, sir. Thank you.
Very honored to have you here with us to discuss these items that are important to us and to the nation. Mr. Marshall, thank you for allowing me
Very welcome.
the opportunity to sit down with you to share some things that we feel are very important.
Sure.
We to kind of go along with your question, we have past couple of weeks been looking seriously into this COVID-19 and how we would want to address taking measures towards protecting our people in regards to this virus. And we sat down with Mr. Porter and Ms. Hayworth and Mr. Smith from IHS. And of course, Mr. Porter is associated with us through the EPA there at the complex. And we all sat down and discussed some concerns and wanted their input on what would be a good direction. And in doing so, they kind of gave us some information in regards to things to be aware of and how that we should address taking care of or doing the protocols in order to protect ourselves against the virus. So.
By the way, Captain Hayworth, I don't know if we mentioned this or not, she's the communication officer, not the communication officer, but the infection specialist, actually, with the Public Health Service. And one of the things we're going to talk about is personal hygiene. Let's start at that level right there. I mean, we'll talk at the very basic level and talk about tribal members and personal hygiene. So, what are some of the things that are being recommended and some of the things that you guys are pushing at the IHS for your patients, your clients, et cetera, tribal members? So, how are you all addressing them on that level,
So basically, like you would for your normal personal hygiene, the things we're stressing are hand washing, hand hygiene with the alcohol-based rub that are at least 60% alcohol. Cleaning your high-touch surfaces like your doorknobs, your countertops. This applies to your home, even places that a lot of people are touching and coming in contact with. Cleaning those frequently with your normal household cleaners. At the healthcare facility, where screening, asking our patients, if you're ill. So we've started kind of doing a little screening process before they enter the facility, taking temps, getting history of recent upper respiratory type or flu type illness, travel history, have you been exposed to ill people? And as far as our staff, we've started also doing the same thing for our staff, taking temps before they come to work and enter the building, stressing the hand hygiene, stressing at this point, those are all normal things for any type of outbreak of a virus. But now that it's at the pandemic level, which is mean we have cases worldwide, those have increased to the social distancing. Try to keep 6 feet distance from people that may be ill, staying home if you're sick. So we're asking the community to help with work, kind of some altered work practices for ill employees.
Some of our listeners, tribal members especially, you may be listening to this radio show and you're saying, in my house, it's fine. We don't have a problem. We keep our house clean, and which I'm sure they do. They may not be to the level of wiping down surfaces with disinfectant and this and that, as they maybe just ordinarily wouldn't, and they may. But regardless, the point is, at this point with this pandemic, we can't take for granted that we'll take care of ourselves, because for every person in your house you come into contact with an average of 10 other people, especially like children. Just because you didn't come into contact with a person down at Walmart or didn't come into contact with a person at McDonald's, other people in the family may have. And so you got to treat it just like, and I hate to say this, you have to treat it like we could possibly all be infected. And so let's keep our environment clean. I've been carrying around this little disinfectant wipes thing. It's a generic, but it meets the standard. Yeah, it'll do the job. And I've been carrying that around with me, and I'll stop and wipe down my steering wheel, wipe my hands down, and take off. I came in this morning, wiped down the table, and you just, you got to be conscious and aware. And
you do. And when you're talking about what you said about we may be fine, but the people we contacted, the data that we get to support the practices we're doing are from the Centers and Disease Control and Prevention, so they're the CDC. So they are updating their site hourly, daily. This morning, their statistics showed in the U.S. that we have 3,487 people known to have COVID-19. And of those, 205 of those persons have a known travel history. 214 of those have a known contact with an ill person. And the other 3,068 people that are under investigation don't have that history. So they don't know where they got it. It's what they're calling community spread. So community spread is where you have areas of the U.S., whether it be a community or a large city, where they have people that are infected, but they don't know where they were infected at. So, you're getting exposed somewhere, even though you haven't traveled or been around someone that you know was sick. So that are the ways that they're classifying the cases, that are brought in by travelers outside the U.S., those that have been in close contact with a known person that's infected with COVID-19, or those that really don't know how they got it. And the reason the virus is spreading partially is, because as your kids, you grow up, you get exposed to colds and this and that. Well, once you go to school, it seems like you've caught everything. That's because you're exposed to viruses or bacteria that your body doesn't know. You're getting them from new people with new viruses. So your body kind of has to work and build its army up to protect against those. And this virus is new. None of us have antibodies or our little armies that our body builds to protect us. So everyone that's infected, your body's having to go to work, and it's having to start building those antibodies. And some of us, our immune systems are stronger than others. Our elderly, over 65, are highest risk. Our community members that have either a medical condition that weakens their immune system, or medications that weaken their immune system, those are our vulnerable populations. So that's why we have to take care of not only ourselves, but protect our elders in the community and our most vulnerable from this.
If there's a bright spot in any of this, with all this message of gloom and doom that we're hearing everywhere, that people tend to want to take it to an extreme. Some people, they want to create this apocalyptic mindset, and not because they want to, but just their imagination goes wild. The fact is, coronavirus has been with us for several months now. Several thousand people have already contracted and recovered, especially the younger, healthier people. And so it's not like we're all going to die. It's a matter of fact, people are recovering every day. But the point is to try to lessen the effect, even if you do catch it, and to get on the other side of it for all of us. And watch out for the elderly. Watch out for those that are most vulnerable. Chief, we're doing some things at the tribe, at different departments, and especially at the complex. And I think we wanted to get this message out as well. There's some things that we've put into place, and just to kind of remind you, we've got them listed here. To schedule an appointment with one of the offices, or I know that we had a meeting yesterday with department heads, and there was a lot of things. The department heads had some great ideas about how to deal with this, and we're all coming together with one plan that'll be universal for all the programs. And so you might just kind of touch briefly on some of the things that we're doing. Say, for example, at the complex.
Yes, thank you, Mr. Marshall. Yes, we have addressed, we've had several meetings to address the concerns. This is a major concern to our populace as far as the Seminole Nation, and our elders and our youth and all walks. And so we have taken the necessary means to have several meetings to discuss these measures. And yes, yesterday we come together with our program directors yesterday and had a discussion with them about some of their protocols and what they might look at doing to help protect the community, protect the services that's being provided to the community and to the Seminole Nation. And so in doing that, we had brought up a discussion about at this time, due to the serious concerns of it, is limiting access to all our to the complex and to our programs.
Good terminology.
But in limiting their access to those locations, though, if there is some concerns that you need to have in regards to those services, if you would please just contact those programs and then try to set up an appointment so that you can so that your concerns can be addressed, so that can help us provide a safer environment for the employees, and then for the people as well, for the clients.
The person, and for an example is maybe someone has some need for some citizenship information, and they need to come up to the citizenship office at the tribe, which is at the complex, and we're asking that you call ahead. A lot of that stuff can be done over the phone. Everybody doesn't have access to online, but if you do, you can drop an email. But if not, make a phone call. Just let us know what your need is. If we can help you, and may be able to help you without even having to come into the complex. But if we have to, we'll send an appointment with you so that we don't have because there's limits of how many people can be together at one time. We can set an appointment for you to come in and be glad to help you with everything we can. We're not trying to exclude anyone from any services. But we do need to limit access for that reason, is not only for your health, but for the health of everybody that you come in contact with.
Right. And all with the knowledge of the serious concern of this, these are just protective measures that we're putting in place, but we still want to provide those services because they're very important to our people. But we're just trying to think of ways that can help provide those services to them and still limit and protect those individuals.
Absolutely.
To continue.
I think that from the meeting, from what I gathered at the meeting yesterday, every program director has a lot of concerns for their population, for their clients and everything, making sure that those services are going to be available to them, but at the same time protecting them and their families. And I think that's you got some really caring, good folks working for the tribe, and that's what we're looking out for. We could talk all day about the various services, such as social services, food distribution, and each one of them has their own protocol. And I think you pointed that out a while ago. Each one of them has their own protocol. We don't have one set blueprint of protocol because every program is different. Some of them, if we feel like that it's just absolutely not necessary at this point, you may at some time call for just a shutdown of that program until we can get through this thing. And I think that's going on everywhere. I know that there's some questions about I know gaming, for example. A lot of the tribes are starting to move toward stopping the gaming operations until they get to a point where they can understand what's going on and they may be able to address it better. Some of them have only called for a 2-week shutdown. I know that I'm sure that the Seminole Nation gaming division, they're looking into whatever needs to be done as well.
Yes, sir. That's a good question. We have definitely looked at that as well, and have addressed our concerns with the gaming enterprise and how they operate, and their steps that they need to take as far as the wipes, education, letting the people understand what's going on, and that we are concerned about that, and implementing those things inside how we operate to maintain the machines, the cleaning up.
I understand they've doubled up, by the way, on their cleaning.
Yes.
And that's a good thing.
And here too as well, in regards to, it is of concern to us in regards to how we operate and how we function that way, but not everybody has the opportunity to function the same way. Mm-hmm. Our dynamics are all different, depending on what nation you are. Mm-hmm. And so that sometimes affects change or not change, so to speak, in regards to what some of those are able to do.
And then our patrons, they have the choice to make their own decisions what they want to do as well, you know. And so I think that's important too.
But we do want them to understand that we are taking those measures very seriously and that they are of concern.
Okay. We a lot of things are going on around the tribe. Captain Hayworth, are there other areas that we haven't touched on that is relating to this that you may think are important?
Well, I would just like to piggyback on what the chief said about some of the changes at the Wewoka Indian Clinic. We are also implementing some changes to try to prevent the spread, slow down the spread of the COVID-19 without taking away vital services and acute needs. So if patients had, and some patients have received a call canceling their normal chronic disease clinic or a scheduled visit, and the providers are calling those patients
That's me.
to see what their appointment was for. Was there anything acute that they needed to be seen for? Making sure they had enough of their chronic medications and offering refills to last a couple months that they can then either get through the mail order through the pharmacy, so they don't have to get out, and also, or if they're here already and they need meds, we're processing all those and then taking them outside for the patient, so that we're not all cooped up in a small area, because the recommendation from the CDC for the social distance and things is 6 foot. So if you have a lot of people that may be vulnerable inside in the waiting room, we're putting them at risk for an unknown exposure. So when they do come and we're taking their information and screening, we're asking them to wait in their vehicle till we get their things ready for them, and then postponing non-critical services. So if they get those calls, it's not that we are trying to prevent them from their care. If they have acute needs and refills and things like that are needed, we are happy to provide those. We are just doing the extra precautionary screening. We have to protect the community and our elders. We also have to protect our healthcare workers, because if we all are sick, then we're not here to provide those services that we provide as part of our mission in an in-health service. So it's kind of a whole community approach. It's changing daily. It's changing hourly.
Speaking of that,
learn more about this.
Speaking of that, do you have any updates on test kits in our area or anything that we don't know about?
I don't have any updates. We have a few at the facility. We're trying to get more, as everyone is. We're also using the Centers for Disease Control protocol and the health department from the Oklahoma State Health Department for guidance on using those. And they have actually a call center, the COVID-19 call center. If patients want to call, patients or staff, the number is 877-215-8336.
877-215-8336. 8336.
And that's through the State Health Department in Oklahoma City. They have a call center.
So if you have any questions at all, just give them a call.
We also, for Indian Health Service, we have a nurse advice line, and we usually promote it for after hours. If patients become ill after the clinics close and they have questions about, do I need to go to the emergency room, or can this wait till morning? So during this COVID-19 issues that we're facing, our 24-hour, our nurse call line is 24 hours. So he can give you the number for that. If you have any questions about, am I sick? Do I need to come in? It's kind of like the chief said, we would like you to call ahead and let us know what's going on with you, so we can direct you to the appropriate screening, or if we can handle this without you coming in and getting out in the public and exposing yourself, then that's what we're trying to do also.
I think it's important to remember and understand that we're in the cold and flu season. We're in the cold and flu season. People are going to get colds. People are going to get the flu. And as a matter of fact, I've known several people that have contracted the flu, and I took my flu shot, so hopefully that'll last until the end of the flu season. But after, Saturday, I went to church over here. We woke Indian Baptist on Saturday evening. Then on the way home, I felt this little sensation in my sinuses, and I thought, oh no. And so I got home, and later that night, I went home, went to bed. I felt good when I got up, but just a little after I got up and went outside, I noticed it was like getting worse and worse Sunday, and so I thought, man, I got to get to the doctor. But I'm not going to panic, because I know that there's other things going on. Well, when I got to the doctor Monday, allergies. That's simply allergies. The doctors checked me all out, and of course that's a relief to know. But it's important that people don't panic, and you don't think everybody that you see sniffling doesn't have COVID-19. However, look out for one another, especially the elderly. If you see some symptoms, elderly are more prone to be affected adversely. And so if you have some elderly people in your home, watch out for them.
We also recommend, we're asking the elderly to kind of keep keep in their homes and keep
Yes.
themselves from potential exposure, we need to check on them. If you know elderly people
But
in
you
your
know
community,
elderly people. You ain't telling me nothing.
I
I'm
know.
going.
We need to check on them to make sure they have
Sure.
things they need that we can maybe pick up for them to prevent them from going out to Walmart or the stores where they may be exposed. So it's more of a preventing those that can't protect themselves.
Let's give them this after hours nurse advice line for Woke Indian Health Service. It's 833-904-0013. That's available Monday through Friday from 4 in the evening to 8 in the evening, or 8 o'clock the next morning. So it's
24 hours
24
right now during this, so that our patients have access, since we're asking them to call and get advice if they want to call the nurse call line 7 days a week, 24 hours right now. That's perfectly accessible to them.
Any last thoughts, Chief?
I'm good.
Okay. And Captain Hayworth, we appreciate you coming on. I mean, we can't say enough about this pandemic situation. However, I think it's important psychologically that you don't scare the kids. This is not an apocalypse. This too shall pass. And even if you get sick, chances are 99% that you're going to get over it. And so let's keep it in that perspective, but keep universal precautions. Keep your hands clean, keep your area clean, and we'll get through this together one way or another. We've done it before. We'll do it again. Thank you all for coming on. I appreciate you, Chief, Captain Hayworth,
My pleasure.
Mark
Thank you.
Williams, Mado, and Jeremy FULTZ. Thank you guys for all your help. And we'll be back next week with the Seminole Nation radio program, Mado.